She has been the face of homicide policing in Metro Vancouver for 6 years, speaking with and for grieving families as part of the integrated homicide investigation team.
What we have right now is a tragedy.
But Jennifer Pound has paid a price for her devotion to her job and her police force.
I just felt like it was spiraling, and every day was not getting better. It was just, I was kind of falling into the abyss.
The RCMP Staff Sergeant has been off duty for 2 years after she was diagnosed with PTSD in 2017. It came after years of face-to-face conversations with the loved ones of murder victims.
I started to absorb the darkness and the pain and the tragedy that the true victims were actually going through, and the families and the loss.
Pound claims she got no immediate help from the force. She had to try to find her own PTSD therapist. When finally directed to the RCMP's Occupational Stress Injury Clinic, she was told it was a year-long wait list.
It really just compounded and exacerbated my own injury.
Pound says she has been getting proper treatment in the RCMP program since April. But long before, she says she felt pressured to return to work or be pensioned out.
I understand that 2 years does seem like a long time if you're getting the treatment that you need from the beginning.
She credits the force for working to destigmatize PTSD, but she says that means more Mounties are asking for help and running into lengthy lineups.
We are seeing first responders everywhere commit suicide. That is a tragedy. We are seeing first responders put their hand up and come forward and saying, I'm injured, I'm sick, and there's no help for them.
The RCMP says 22 officers, either serving or retired, have ended their own lives since 2014.
It's important to get them, though, that access quickly.
Canada's former Auditor General sounded the alarm on mental health concerns for Mounties in a scathing report 2 years ago.
This has to succeed for the RCMP.
Last year, Justin Trudeau said his government was on it.
We were pleased to put significant amounts of new funding towards PTSD and mental health services for the Royal Canadian Mounted Police.
How much? The 2018 budget pledged just over $21 million over 5 years to support Mounties' mental health needs. The Ministry of Public Safety says just under $11 million will be spent to have psychologists assess Mounties for PTSD every 3 years, starting next April. And it says 90% of Mounties sent to operational stress injury clinics get an appointment with a psychiatrist within 6 months. But Pound says while they might get a psychiatric assessment that fast, it takes another 12 months to get therapy. She started a blog for other struggling first responders. And as Election Day approaches, she hopes her message gets to campaigning politicians.
What would you like to hear from the party leaders?
We need resources. I want to hear that they understand and they get that we're in crisis and they are going to do something quickly.
If not,
I can absolutely say that we are in crisis and it's only going to get worse.
Dan Burrett, CBC News, Surrey.